In reality, many people who lose a tooth have already heard about dental implants, but once they start researching, anxiety often kicks in. Some hear that implants are extremely painful. Others worry that the implant post might be rejected by the body. Some even come across frightening stories like implants are dangerous, your whole face will swell, or you could damage your jawbone. And because of these fears, many people end up delaying treatment for years. But the truth is, dental implants are currently considered one of the most successful and reliable solutions for replacing missing teeth in modern dentistry. When performed with proper planning, correct technique, and a sterilized surgical environment, implants are very high success rate and can last for decades, sometimes even for a lifetime with proper care. The important thing is understanding the difference between normal healing reaction after implant surgery and warning signs that actually require medical attention. After an implant procedure, it is completely normal for the body to respond with mild swelling, a slight discomfort, or a little bleeding during the first few days. These are natural healing responses, not dangerous complications, as many people assume. In this video, I will clearly explain what reactions are considered normal after getting dental implants, which symptoms you should pay attention to, when you should return to the clinic immediately, and most importantly, how to have your implant heal well and last for many years. The first thing is, are dental implants really easy to reject? This is probably one of the biggest concerns many patients have. A lot of people ask, Doctor, can my body reject an implant? What if my body doesn't accept it? Actually, implant failure rates today are very low. Under proper treatment conditions, dental implants have an extremely high integration success rate. One reason is that implants are made from medical-grade titanium, a material that has been widely used in medicine around the world, especially in orthopedic and bone grafting. Titanium is highly biocompatible with the human body. After implant is placed into the jawbone, the bone gradually grows and bonds tightly around the implant surface. This process is called osseointegration. Once the implant integrates successfully, it functions much like a natural tooth root. So, why do some implants still fail? In most cases, failure is not because the body rejected the implant. Instead, it is usually related to factors such as existing oral infections, untreated gum disease, or infection in nearby teeth, poor oral hygiene, incorrect assessment of bone condition, improper implant position or size, or inadequate post-surgical care. That's why the evaluation and preparation phase before implant placement is extremely important. At specialized implant centers, patients are usually advised to undergo a 3D cone CT scan to assess bone quality and density, a full mouth infection and gum evaluation. Treatment for gum disease and cavities is necessary, and detailed implant treatment planning before surgery. Overall, implants themselves are not something to fear. What truly matters is proper diagnosis, correct technique, and an experienced doctor. The second thing is that, does getting an implant hurt? This is another question almost every patient asks before treatment. Most people imagine implant surgery as a major procedure involving drilling to the jawbone, so naturally they expected it to be very painful. But surprisingly, many patients say afterward, that was much easier than I expected. During the implant procedure, the treatment area is completely numbed with a local anesthesia. So, in most cases, patients feel little to no pain during surgery itself. After the anesthesia wears off, the most common sensation is mild soreness or pressure, similar to what you might feel after a tooth extraction. In fact, many patients say recovering from an implant is easier than removing a difficult tooth. Modern implant systems use highly precise instruments and techniques which minimize traumas to the surrounding tissues and when performing correctly. After surgery, doctors will usually prescribe pain relief medication, anti-inflammatory medications, and cold compress instructions and home care guidance. As a result, most patients are able to continue light daily activities quite normally after the procedure. So the important thing to understand is the discomfort during the first few days after implant surgery is a normal part of the body healing process. However, symptoms such as pain that gets worse over time, pain that does not improve with medications, or severe pain accompanied by the fever or major swelling. These are warning signs that should be checked by your dentist immediately. So rather than being over afraid before treatment, what matters more is choosing the right clinic, the right doctor, and receiving proper follow-up care afterward. The third thing is swelling or bleeding after implant is normal after implant surgery. Many people become worried when they notice swelling, a slight bleeding, or bruising around the surgical area. Some immediately think something has gone wrong, but in reality, these are often very normal healing response after surgery. First is a minor bleeding. During the first 24 hours, it's common for the implant area to have a little blood or for saliva to appear slightly pink. This happens because the gum tissue and bone are beginning to healing process. As long as the bleeding is light and not flowing continuously, it is usually not a cause for concern. Next is swelling. Swelling is typically most noticeable during the first 2 to 3 days after the surgery. It may be more significant in cases involving multiple implants placed at once, bone grafting, sinus lift procedures. Some patients notice mild swelling the same day as surgery, with slightly more swelling on the second or third day. After that, it usually improves quickly, within about a week. Most people return close to normal. Some patients may also develop bruising around the cheeks or down toward the neck. This is simply minor bleeding under the soft tissue and generally fades away naturally over time. So the key point is mild swelling, mild discomfort, light bruising, or slight bleeding during the first few days is usually normal. So there's no need to panic if your body reacts after implant surgery. What matters most is monitoring the healing process correctly and attending follow-up appointments as instructed. The fourth thing is warning signs you should never ignore. As mentioned earlier, mild swelling and discomfort are usually normal after implant placement. However, there are certain symptoms you should never ignore because they may indicate infection or implant complications. The first warning sign is pain that becomes stronger over time. Normally, discomfort should gradually decrease day by day, but if after several days the pain keeps getting worse, medication no longer helps, the pain becomes sharp, throbbing, or severe, you should return to the clinic immediately. Another important sign is fever or excessive fatigue. Feeling slightly tired during the first 1 or 2 days can be normal, but persistent fever, especially if it increases several days later, may suggest infection around the implant site. Next is persistent swelling is another concern. Typically, swelling peaks around day 2 or 3 and then improves. But if the swelling continues to grow, the area becomes very firm and tight, or swelling does not improve after 5 to 7 days, you should seek evaluation immediately. Other warning signs include pus discharge, bad smell, yellow or white fluid, or an unpleasant taste in the mouth. These are common indicators of infection. Patients should also pay attention to prolonged numbness in the lips, chin, or tongue. Mild temporary numbness can happen due to swelling pressing on nearby nerves, but if numbness lasts for weeks, without improvement, imaging should be taken to ensure the implant is not too close to the nerve. The most important advice is do not simply wait and hope it gets better. In implant dentistry, problems are much easier to manage when detected early. The fifth thing is, can implants be placed immediately after tooth extraction? Many patients wonder whether implants can be placed right after removing a tooth, while others are told they need to wait several months. So, which is correct? The answer depends entirely on the condition of the bone and whether infection is present. For example, if a tooth is lost due to trauma and fracture, and there is a little to no infection, doctors may be able to extract the tooth, place the implant immediately, and sometimes even provide a temporary tooth shortly afterward. This approach can help reduce bone loss, preserve gum aesthetics, shorten treatment time. However, immediate implants are not suitable for every case. For example, the condition with long-term infection, large size, severe gum disease, significant bone loss, or chronic abscess often leave the surrounding bone unstable and unhealthy. Placing an implant immediately into the infected area significantly increases the risk of failure. So, in these situations, the doctor may recommend extracting the tooth first, cleaning the infected area thoroughly, and allowing the bone to heal for several months. After that, proceeding with an implant placement later. Many patients feel impatient when they hear they must wait, but in reality, waiting for the right timing can greatly improve the long-term implant success. In implant dentistry, success is not about doing things quickly, it's about doing them correctly and safely. The sixth thing is why the doctor's experience matters so much. Many people believe that choosing an expensive implant brand automatically guarantees success, but in reality, the material itself is only one part of the process. What matters even more is the doctor diagnosis, treatment planning, and surgical skill. There is a saying in implant dentistry: the same implant can produce completely different results depending on who performed the procedure. For an implant to remain stable long-term, the doctor must carefully manage many factors, including bone density evaluation, precise implant positioning, avoiding nerves and important anatomical structure, controlling bite forces, managing gum tissue, and maintaining strict sterility throughout surgery. In many implant cases today, the procedure involves far more than simply placing a titanium post into the bone. Additional techniques may also be required, such as bone grafting, soft tissue reconstruction, sinus lift procedures. These treatments help create proper conditions for stable implant integration. Another detail many people overlook is surgical suturing technique. If the gum tissue is not properly closed, the wound may reopen, the risk of infection increase, bone loss become more likely, and implant integration may be compromised. This is one reason why some patients recover very smoothly, while others experience prolonged swelling or complications. So, when choosing implant treatment, patients should not focus only on price or implant brand. More importantly, ask, does the doctor have extensive implant experience? Is proper imaging and sterilization being used? Is there a clear treatment plan? Will follow-up care be closely monitored? Because implants directly affect your jawbone and long-term chewing function. Doing the procedure correctly from the beginning is far more important than fixing complications later. The seventh thing is, how long do implants last? If implants integrate well and are cared for properly, they can last for decades, sometimes even for life. Long-term success depends on not only the surgery itself, but also on how well the patient maintains oral health afterward. Some people assume implants are artificial teeth, so they can't develop problems. That's not entirely true. While implants themselves do not get cavities, the surrounding gums and bone can still become inflamed if oral hygiene is poor. When plaque and bacteria accumulate around implants over time, patients may develop peri-implant inflammation. If left untreated, bone around the implant gradually deteriorates. The implant may loosen and eventually fail. That's why patients should continue to clean around implant carefully as instructed. The second key factor is regular follow-up visits. In many cases, early inflammation around implants cause no obvious symptoms. Problems are often detected early through dental x-rays and professional examinations. Routine checkup help monitor implant stability, remove plaque buildup professionally, detect early inflammation, and prevent serious complications later. Other factors such as heavy smoking, teeth grinding, or uncontrolled conditions like diabetes can also reduce implant longevity if not properly managed. The most important message is this: dental implants are very safe and effective solution for missing teeth, but long-term success requires teamwork between both the doctor and the patient. The doctor must perform the procedure correctly, and the patient must care for the implant properly afterward. When both factors are managed well, implants can function as strong, stable teeth for a very long time. Finally, the final message: like any medical treatment, implants involve normal healing reaction afterward. The important thing is understanding what is normal and what is not, so fear and misinformation do not create unnecessary anxiety. Many people delay treatment for years because of frightening stories they hear from others. But in reality, leaving missing teeth untreated for too long can lead to far more serious problems. So today, dental implants have become one of the most widely used tooth replacement solutions worldwide, with very high success rates. The key to safe and successful implant treatment is proper examination, correct diagnosis, proper surgical technique, and good post-treatment care. If you are missing teeth and still feel worried about implants, the best thing you can do is not spend endless hours reading frightening information online, but instead consult an experienced implant specialist directly. Every patient has a different jawbone condition, gum structure, and overall health status. When properly evaluated from the beginning, implant treatment can be much safer, more comfortable, and more predictable. Hopefully, this video has helped you better understand what is normal after implant surgery, what signs require attention, and when you should return to see your doctor. If you still have questions about dental implants, feel free to leave a comment below so the doctor can answer them in the future videos. Thank you for watching. See you.